Burns can happen in a heartbeat, a moment of distraction turning into a lifetime of consequences. Your child could be at risk. With me today, I have a medical clinical officer with a soft spot for kids. He has some insightful tips for you. Welcome. So today with me is Dr. Elijah. Dr. Elijah, you're welcome.
Thank you for having me.
Can you tell us about yourself?
In brief, my name is Semakula Elijah Enoch. I am a Ugandan and I'm a medical clinical officer by profession.
Thank you so much, Dr. Elijah. We are glad to have you here.
Glad to be
So
here.
one of the pressing factors mothers have are burns. How do they happen? What should we even do if these burns happen? What causes them in the first place? What is the immediate care we should give? So with me, I have a few questions from our community of mothers, and we believe you're in the best position to answer them.
Sure.
Okay, so the first question is, there's all these burns that happen, but are they different? How do they all impact the skin, and what are the results per burn?
That's a very good question. For burns, basically we have three types. We have the first degree, we have the second degree, we have the third degree. Or sometimes the second and third degree are called partial thickness and full thickness. We're going to delve deeper into that as I try to briefly classify each. So first degree burns usually affect the outermost layer of the skin, which is the epidermis. The skin usually has three layers basically. It's divided into the epidermis, the dermis, followed by the fatty tissue, and then the tendons, the muscles, and whatnot. So the first degree affects the outermost layer of the skin, which is the epidermis. Usually these ones, they're quite painful, they're red, but they're not so much to worry about. The second degree burns have more pain because they, like I told you, they're called partial thickness, so they eat away the epidermis, they dig into part of the dermis. So they cause more pain, and they tend to cause blisters as well because the fluid from the vessels that are damaged tends to flood the area and cause that swelling, which we know as blisters. Then we have the full thickness or the third degree burns. These ones eat away the epidermis, the dermis, and even go deeper. Sometimes in other classifications, they can even go deeper until the bones, the muscles, the tendons, and eat away as much as that. Yeah, so in brief, that is how burns are classified.
Okay, thank you so much, Dr. Elijah. So after understanding this guide, a lot happens when a child is burnt. I myself have been in that same position. There's a lot that goes into your mind. What are the first steps that we should take?
Well, basically, before you attempt to take any steps of first aid, you should know what has caused the burn. Maybe what I left out at the beginning would be the different causes of burns. We have burns from direct heat, from hot liquids, we have burns from chemicals, we have burns from electricity. So first, before you take any action, identify what has caused the burn. If it's a chemical, you have to brush it away and ensure that at least most of it has been rubbed off before you pour on water. If it's an electric burn, make sure the child is away from that electric source. If it's hot water, make sure you are away from the area with the hot water. So the number one thing you should do after identifying what has caused the burn, pour there as much water as you can. The burnt area should be under cold running water for at least 10 minutes. To ensure that the place cools down and all the heat that the skin has absorbed is taken away by that water. Secondly, remove any tight-fitting clothes, remove any jewelry. However, if a cloth or a particular jewelry is stuck to the skin, you need to go to the doctor to check that out. Don't attempt to remove anything that happens to be stuck to the skin. So those are the few immediate action steps you can take as first aid for a burn.
Okay, so Dr. Elijah, there are all these things that society tells us. You can put cow dung, you can put honey, you can put milk. How true is this?
First of all, do not put any of those things listed above. Do not put cow dung, do not put milk, do not put butter, do not put Vaseline. Why cow dung? First of all, it's a bit obvious. A burn is a wound. You're putting something that is unclean, full of germs, bacteria that can potentially infect your wound and cause even further problems. So do not put cow dung, do not put milk, do not put butter or oils, because these things trap heat in the burn, and what we want to do is remove the heat that has been caused from the burn, which water does well. So all these remedies that are usually used, ideally they don't work. The best remedy is cool running water for that place.
Okay, thank you so much, Dr. Elijah. So the other question from our community is, just like any other disease or any other wound, there is usually a duration which it takes to heal.
True.
So how long do burns take to heal?
Well, usually the first degree burns, they're usually minor burns. They can take a week or two at most. The second degree can take quite a longer time, 2 to 3 weeks, even more, depending on how big the area it has covered. Basically that. Then the third degree burns, like I explained to you in the classification earlier, they tend to take a longer time because they affect more tissues, and most of the times they are deeper. Not most of the times, they are deeper than the other burns. So they take quite a longer time and even may require more professional treatment, such as surgeries, where they can graft skin to place in that part, and very many other procedures. Like I told you, as you go deeper into classification, you'll find that these burns can eat as much as muscles and even can go until the bone. So you require some specialized medical care to cater for such scenarios.
Okay, so Dr. Elijah, I have a very interesting question here. So one of the mothers said, I have been battling with a scar for the past 14 years. I got burnt when I was a bit younger, but this has brought a lot of trauma. How can I deal with a scar from a burn?
Wow, that's a good question. Well, scars ideally form depending on what the type of burn has been and how good you've taken care of that burn. Usually first degree burns don't cause scars as much as long as you've taken care of it well. Second degree burns, however, cause usually minimal scarring, and third degree burns sometimes, most of the time, usually cause a lot of scarring. So depending on how this particular wound has been taken care of, it can minimize scarring. Usually when you go to the hospital, there is something called debridement. Debridement simply means removing away particular dead tissue so that you can allow the skin to heal properly. So that can also help in prevention of scar tissue or scar tissue formation, and basically the way you take care of that wound, keeping it clean, keeping it under gauze, can all prevent the scarring. And maybe during the healing process, we usually recommend use of burn ointments. What these burn ointments do, one, some come with different formulations where they can have antibacterials to prevent any infections from occurring and other substances that will help treat the burn. So in addition to that, these ointments help to keep the burn moist, which is very good so that it can heal properly and not form that type of bad scar tissue that is bad generally for aesthetics.
Okay.
So to prevent any of these kind of bad formation of scars, I would strongly advise, even if it is a first degree burn, however small it is, go to the hospital, let your doctor check it out, and you get the appropriate medication that will help you to recover fully and also recover aesthetically, if I may say it like that.
Okay, thank you so much, doctor. So, just like any other thing, wounds can come with a lot of pain. and these are burns even, so they come with that hitting sensation and very, very uncomfortable. So as you've said, we have first degree, second degree, and third degree. I might have a minor burn that is like a first degree, but I'm experiencing a lot of pain. How do I deal with that?
Well, usually they are over-the-counter painkillers. There is one known as ibuprofen. It's a good anti-inflammatory painkiller, if I may say it like that in simple terms. So you can get these over-the-counter painkillers, and then the running water. Running water helps a lot in keeping those burns, drawing that heat away. Usually for first degree burns, second degree burns, after 24 hours that pain will subside. So during that time you can take some painkillers, the running water, and then keep the place covered as well, so that you avoid scraping it from small movements, which will add you more pain. So basically that, just some painkillers, running water, and keep the place covered.
Okay, Dr. Elijah. So as you explained to us all these wonderful types of burns, I think our parents understood them so well. How can we prevent our children from having these burns?
Brilliant question. So in Africa, Uganda, we haven't really embraced smoke detectors. However, these smoke detectors can help us to detect where fires are. So the first preventative measure that I feel would be very good is to use these smoke detectors. You can install them in the whole house, that anywhere where there is a fire you can know, and keep your children away from that source. Secondly, you can child-proof all electrical outlets, so that these kids cannot poke and get shocked and burnt at the same time.
Yes.
Make sure there are no live wires lying around. For any chemicals that you may have in the house that can insult the skin or cause injury, try to store them as far away as possible so that the children cannot reach them. For places like the kitchen, when you're cooking things like hot water, make sure the handle is faced the other side, like away from the child, where they can easily pass and knock it. Make sure it's faced the other way, and make sure they are supervised, because if you're cooking something that is hot, you need to keep the child away from the kitchen. So they're just simple steps, but at the end of the day, it's being vigilant, knowing where your child is at a particular moment, and avoiding future injuries from occurring.
Okay. So another mother asked here, while I was treating my son's wound, it got badly infected and it even got pus in it. It was a very terrible experience, but I still don't know how to prevent it. So Dr. Elijah, how do we prevent these wounds from getting infectious?
So like I said, in the first 8 steps that we started with, the major step to keeping these ones from getting infected is 1, covering them with a clean cloth. If you have a good bandage at home, it would be best, or gauze, it would be best a non-stick one, because if you get a stick one, it would be sticking to the wound, which is painful as you remove it. So if you can get a non-stick gauze or bandage, that would be helpful, keeping the wound covered. If you have a second degree, third degree, you're supposed to change that dressing at least twice a day. Put there the ointment that you're given. Usually these ointments, aside from the other ingredients that are in them, they have antibacterials in them, so they help prevent infections on those wounds. So 1, keeping the wound clean, keeping it covered, avoid touching it with dirty hands, because you can also come when you're going to change it, but your fingernails are dirty, your hands are dirty, and also the kids' nails are dirty. So generally touching it when you're clean, keeping it clean. And secondly, you can watch out for signs of infection early enough. When you see the place is just swelling more, it's tending to have a little bit of pus, rush to the doctor immediately. When your child gets a fever, rush to the doctor immediately, because these are all signs of infection.
Okay, thank you so much, Dr. Elijah. As we conclude, I request you give us a guideline of tips that we can follow when we have a burn immediately? What should we start with? What should follow? And what should we end with?
Okay, just like I said before, when we're starting, the steps are quite simple. First, inspect the area, check the insulting substance, whether it is still there. If it's electricity, make sure your child is away from the electric source. If it's heat from water, make sure they are away from the water, they are away from the heat of the pan or the fire. If it's a chemical, like I said, before pouring water there, first try to brush it off, because some chemicals, when you pour in water, you just make things worse. So first brush it off, then pour as much water to that place as you can. After doing that, removing the insulting substance away, keep the place under running water for at least 10 minutes. Thereafter, cover it, and I would suggest that you seek medical attention thereafter. For kids, it can be sometimes hard to console them, but you can try to distract them here and there with storybooks, their favorite videos, to keep them composed, and listen to them. Make sure you listen to your kid, because your child rather. If you do not listen to them, it kind of affects them psychologically. So listen to them. Make sure you what am I looking for? It's not caress. It is It's not console. What
reassure them.
Make sure you reassure the child constantly. And you could get over-the-counter painkillers in the meantime, but seek medical attention. Let your doctor assess the burn that has been caused and give you the appropriate treatment. Avoid treating these things from home. Yes, some things like the first-degree burn can be managed from home, but you need to seek medical attention, because sometimes burns can be as severe as burning the genitals, burning the trunk, the chest and the back, burning anywhere that has folds. You really need to see a doctor for these types of scenarios, because it is hard for you to treat them in such places, but a doctor will know how to handle such cases.
Thank you so much, Dr. Elijah. It's been wonderful having you here today. I believe our mothers have got enlightened with this information. If you like this content, please subscribe and follow our socials.